Okay, I want to pick up two more parts to the skull that I left off. First of all, I need to cover bony orbits. These are the bony cavities where you find your eyes. They're firmly encased, and then they're cushioned by a layer of fat tissue around them. And the thing that makes them interesting is you have 7 bones, or parts of 7 different bones make up the orbits. So you can see from this picture here that we've got the frontal bone, and as we move around, we've got part of the maxilla. There's the lacrimal bone. We have part of the sphenoid. Deep in there, we find there's the palatine bone. Anyway, so the 7 though are frontal, sphenoid, zygomatic, maxilla, palatine, lacrimal, and ethmoid. Those are the 7 that make up the orbital to the eye. So it's kind of interesting. Okay, second thing I should have talked to you about were the nasal cavities. And the nasal cavity, this is constructed of both bone and hyaline cartilage. The roof is formed by the cribriform plate of the ethmoid bone. So this whole thing up here is the ethmoid bone. The lateral walls are formed by the superior and middle conch, and that's part of the ethmoid bone still. So you can see there's the superior conch, there's the middle conch. There's also an inferior, but we're right now, there's the inferior nasal conch, okay. Anyway, other parts that form the lateral walls, the outside walls, are the perpendicular plate of the palatine, and then like I said, the inferior nasal conch as well. And then the floor down here at the bottom, this is formed by part of the maxillary bone, and this is the palatine process of the maxillary bone. If you go on back, there's the palatine bone itself. And then once you leave that, if you're feeling in the roof of your mouth, you have hard palate and it changes, then all of a sudden it goes soft. So once you get past this palatine bone, you move into your soft palates. So anyway, that's what makes up the nasal cavity. Okay, that's just showing the midline, the septum down the middle, because the vomer is the one right down the middle that we see. That's how I can tell where we're at. And then there's the nasal bone up top. They come together. Or not the nasal bone, the perpendicular plate of the ethmoid. There's the nasal over there, but this is the ethmoid bone, or the ethmoid bone here. Okay. Anyway, it's interesting. The paranasal sinuses, these are mucosa-lined air-filled sacs, and they're found in, they say 5 of the bones, but that's only because the maxilla is 2 bones. So the 5 bones you're going to find are the frontal. You can see up the top there, the frontal, that's 1 bone. The ethmoid, straight back here, there's the ethmoid sinus. That's going to have those sacs in it. The sphenoid bone, and then the 2 maxillary bones here. Air enters the paranasal sinuses from the nasal cavity, and then the mucus actually drains into the nasal cavity from the sinuses. But the whole purpose here is we need to lighten the skull, and that's what they do, so we don't have just these real thick bone areas. The other thing is they play a role in resonance of our voice. So that's the paranasal sinuses. Moving on, we have the hyoid bone. This is not part of the skull, so we're moving down, but it lies just inferior to the mandible, so right below your jawbone here in the neck. This is the only bone in your body that doesn't articulate directly with other bones. But it is an attachment point for neck muscles that raise and lower your larynx during swallowing and during speech. So that's the important. It's kind of out there on its own, but since we did the skull and moved down, that's next. Okay, let's keep moving here. This is probably we're going to make up the largest portion of this video. This is the vertebral column, and in the vertebral column you've got 26 irregular bones, the vertebrae. They're connected in a way that give you a flexible curve structure. Now, I remember numbers because I know I eat breakfast at 7, so I have 7 cervical vertebrae. I eat lunch at 12, so I have 12 thoracic, and I eat dinner at 5, so I have 5 lumbar. So that's the easiest way to remember those, the number of bones you have: 7 cervical, 12 thoracic, and 5 lumbar. And then you get down into the sacrum and the coccyx, which those are actually vertebrae that are fused together. You've got 5 in the sacrum and 4 in the coccyx. You do have curvatures, a number of curvatures in here, and these are normal. You have a nice cervical curvature up here, and then you've also got a lumbar curvature. Your lumbar and your cervical, these are said to be posteriorly concave curvatures. And then you've got one that's posteriorly convex, and that's, well, there's 2 of them actually. It's the thoracic right here, and then the sacrum down here. That's also a convex. So there's other abnormal curvatures of the spine, some that I've got an understanding, like scoliosis is the waving side to side. Kyphosis is the hunchback. You see, particularly in older men and women, how they get hunched over. That's kyphosis. Lordosis, I don't have an understanding. It's sway back, but I don't have a good understanding of that one. So I'm not going to try to explain that one to you. Okay, moving on, you have these ligaments. So here's the anterior longitudinal ligament. This sheet runs all the way down the front side of your vertebrae, and then right back here you've got the posterior ligament that runs all the way down. And these things really do run from the neck to the sacrum. And then from there you've got other ligaments joining the vertebrae together, which is kind of important. Between your vertebrae, you have your disc, and these are intervertebral discs, and they are cushion-like pads. They're composed of 2 parts. You have a fibrous outer portion out here. This is the fibrous portion, and that's going to be fibrocartilage. And then this inner part, this nucleus here, this is more gelatinous, but it still gives the disc its elasticity and compressibility because it's a little more spongy. So those are your intervertebral disc. As we continue down the vertebrae itself, this is a good example of a thoracic vertebrae. We have the body, or the centrum. I'm going to use body for this class. It's disc-shaped, and this is the weight-bearing region of your vertebrae. We've got the vertebral arch, but look, the vertebral arch, we start here and we go clear up and over. That's the vertebral arch. And so it actually includes the transverse process, but we also have, okay, so past the vertebral arch, those 2 together, along with the body, they enclose the vertebral foramen, and it's in this vertebral foramen that your spinal cord is going to pass through. Anyway, off the back here, we've got the spinous process. They stick straight out the back. And then I've already said you have the transverse processes off to the side. You also have articulating processes. So these processes down here are where one vertebrae rubs up against another. So articular processes occur on all your vertebrae, and then you have both superior and inferior. Now you notice on these though, I've got these other surfaces here. Well, that's because this is a thoracic vertebrae. And so those processes are where the ribs rub into the thoracic vertebrae. So we'll come back to those processes when we're going to start with cervical and work our way down. So here we're looking at C1 and C2. You've actually got 7 cervical vertebrae. These are the smallest and the lightest. C3 and through 3-7 are distinguished with an oval body, and then they have short spinous processes. Okay, see my little spinous process off the back here. Anyway, those are quite a bit smaller in C3 through C7. But what stands out here are these transverse foramen. These are areas for a nerve to pass through, actually pass through the bone itself. And the cervicals are the only ones that have the transverse foramen, those holes out to the side. The others have areas for nerve to pass, but they actually come out between them. And so it's not the same, and you'll clearly see a difference between them. C1 up here, this is known as the atlas. Remember, atlas held up the world. Well, C1 holds up your head. If you notice, there's no body and not really a spinous process in this case. It consists of an anterior tubercle, and then there's the anterior tubercle, there's the posterior tubercle. So I kind of give you directions. This is the front, this is the back. The interesting part is you have these surfaces, these articulating surfaces for the occipital condyles. So the skull sits down on this part. So this holds up the skull, and that's the job of C1. As we look at C2, this is the axis. So this is the second one going down. You can see on C2, we do have sort of a body, not a lot of a body, but a little one there. Okay, we have a short spinous process. We still have those transverse foramen with the transverse process with the transverse foramen in them, and then the articulating surfaces. That's where C1 is going to rub on here. But this is the piece that stands up. It looks like a little thumb sticking up. It's called the dens. And the dens is the pivot point for the rotation of the atlas. So the atlas is on there and spins back and forth. So that gives you an idea of C1 and C2. Okay, let's move into thoracic, and I had that one thoracic a little bit ago. There are 12 thoracics, T1 through T12, all of which articulate with ribs. So we have these costal facets. Costals, we're talking about the ribs at that point. Okay, so that's one of the important pieces. We've lost the transverse foramen, but we still have transverse process. But look how sharp the spinous process is here coming off the back. That's how we know that we can identify the thoracic vertebrae. Now, as far as identifying this, if they just hand you a single vertebrae, to me, these things look like a giraffe. This is the nose of the giraffe, and then you've got the horns and little ears sticking up. So it's got the shape of a giraffe to me. So that's how I remember them. So the important part on thoracic vertebrae is they do articulate with ribs, and they do have a sharp spinous process. As we go down, this is a lumbar, and you can see that my sharp spinous process has now become club-shaped. I have really short little transverse processes, but I still have these articulating surfaces where one vertebrae is going to rub into the next. But look at what happened to the body. The body got big, it got thick. This is the weight-bearing area for the lumbar. So these guys are going to hold up a lot. Now, as far as identification, I may be wrong, but that to me, this looks like the nose of a moose. So giraffe for the thoracic and moose for the lumbar. And if that helps you learn these things, perfect. Okay. Moving down, this is the sacrum. Now in the sacrum, take a look. You actually have 5 vertebrae that have fused together, and they articulate with L5, the 5th lumbar. And then they also articulate with the bones of your hips. And there's some major markings in there, but honestly, I'm not going to hold you to any of the major markings. If you know this is the sacrum, you're in pretty good shape. And then moving down from the sacrum, we've got the coccyx, and you can count the vertebrae here. We've got 1, 2, 3, 4. Usually it's 4, sometimes it's 3, sometimes it's 5, but all these are just more little fused vertebrae coming together, okay? So that ends my video on the, let's see, we covered the orbit, the nasal cavity, and then the vertebral column. So let's stop there.